Today we're talking about the patient who presents regarding lipo 360 of their abdomen and torso versus a tummy tuck. So obviously most patients present and they say, we want to get liposuction circumferentially around the abdomen and the posterior love handle and the bra strap area. And obviously there are a few patients that are candidates for that. Those patients ideally great quality skin, just localized fat deposits in those areas, and they don't have any relaxation of the fascia. And they're not overweight. With them, you can expect good skin tightening. Obviously, the younger patient's skin going to tighten up better. And then two is that they don't have other problems. I would say the overwhelming majority of the patients that I see have an issue both with some fat. In the abdomen, you got to realize there are two layers of fat. You have scarpous fascia that separates the top layer or the superficial fat and separate it from the deeper layer of fat, which is closer to your muscles. So particularly in the lower abdomen, below the belly button, the women have a little pooch. That's because the deeper layer of fat is thicker. So it's safer from a suctioning standpoint to stay in that deeper layer or beneath scarpous. But a lot of these patients, like I said, they have relaxation of the muscles, so their belly bulges, they have extra skin that hangs over, and then their skin quality may not be good, such that they've got stretch marks or stria. And stria are like tears in the dermis of the skin, and as a consequence, the skin can't tighten up as well as it should functionally. So those people are much better off getting a tummy tuck where you cut the extra skin out, you liposuction out of the central part of the abdomen, you're directly excising that deep layer of fat beneath the belly button, and then you're tightening the muscles. So different approach to a different subset of patients, but like I said, most patients come in and they, of course, they want liposuction alone because shorter recovery, smaller incisions, and less of a surgery. However, a patient should select between those two with what's going to be your best option, and that requires on the guidance of your surgeon.